During hemodialysis, a patient suddenly reports chest pain and shortness of breath. What is the technician's first action? A. Stop ultrafiltration and return the blood. B. Immediately call emergency response team. C. Administer saline bolus. D. Continue dialysis but reduce blood flow rate. Answer A. Chest pain and dyspnea may indicate air embolism or cardiac complication. The technician must stop ultrafiltration, return the blood safely, and prepare for emergency intervention. Which water treatment step is specifically designed to remove chloramines from the water used in dialysis? A. Reverse osmosis. B. Deionization. C. Carbon filtration. D. Ultraviolet irradiation. Answer C. Carbon filters remove chlorine and chloramines. Without this, patients are at risk of hemolysis during dialysis. A patient's venous pressure alarm continuously rises during treatment. Which is the most likely cause? A. Dislodged arterial needle. B. Kinked venous bloodline. C. Drop in dialysate conductivity. D. Air in the dialyzer. Answer B. A kink or clot in the venous line increases resistance, leading to rising venous pressure alarms. Before cannulating a new AV fistula, the technician should assess for A. Bruit and thrill. B. Radial pulse. C. Blood glucose. D. Blood pressure in both arms. Answer A. A functional fistula should have a palpable thrill and audible bruit, indicating blood flow. A dialysate conductivity reading is below the acceptable range. What should the technician do? A. Continue treatment but lower blood flow. B. Stop dialysis immediately. C. Increase dialysate temperature. D. Administer saline bolus. Answer B. Low conductivity means underdialysis or risk of hemolysis. Treatment must be stopped until corrected. A patient begins to experience muscle cramps near the end of dialysis. What is the best immediate intervention? A. Administer hypertonic saline or normal saline bolus. B. Increase ultrafiltration rate. C. Lower dialysate temperature. D. Reposition needles. Answer A. Cramps are often due to excessive fluid removal. Saline restores intravascular volume and relieves symptoms. Which type of hepatitis is most commonly transmitted in dialysis units due to blood exposure? A. Hepatitis A. B. Hepatitis B. C. Hepatitis C. D. Hepatitis D. Answer C. Hepatitis C is blood-borne and prevalent in dialysis patients. Strict infection control is required. What is the maximum allowable level of endotoxins in water for dialysis according to AAMI standards? A. 0.25 EU/ml. B. 0.5 EU/ml. C. 1.0 EU/ml. D. 2.0 EU/ml. Answer A. AAMI requires ultrapure water with endotoxin levels less than 0.25 EU/ml to prevent pyrogenic reactions. What is the main purpose of the air detector in the extracorporeal circuit? A. Prevent clotting in the dialyzer. B. Detect leaks in dialysate lines. C. Prevent air embolism in patient. D. Control ultrafiltration rate. Answer C. Air detectors sense bubbles and prevent them from entering the patient's bloodstream, avoiding fatal air embolism. A patient's KT/V value after dialysis is consistently below 1.2. What does this indicate? A. Adequate dialysis dose. B. Excessive ultrafiltration. C. Inadequate dialysis clearance. D. overestimation of urea removal. Answer, C. KT/V less than 1.2 indicates insufficient urea clearance. Dialysis adequacy must be reassessed. Which anticoagulant is most commonly used during hemodialysis? A. Warfarin. B. Heparin. C. Aspirin. D. Citrate. Answer, B. Heparin prevents clotting in the extracorporeal circuit during dialysis. A patient undergoing dialysis develops sudden hypotension. What is the first intervention? A. Trendelenburg position and saline bolus. B. Administer antihypertensives. C. Increase ultrafiltration. D. Stop dialysis immediately. Answer, A. Hypotension is treated by placing the patient supine with legs elevated and giving saline to restore intravascular volume. Which lab value is most important to monitor for patients on erythropoiesis-stimulating agents? A. Calcium. B. Potassium. C. Hemoglobin. D. Albumin. Answer, C. ESAs increase red blood cell production. Hemoglobin must be monitored to avoid overcorrection and cardiovascular risks. What does a positive blood culture from the dialysis machine sample line indicate? A. Water contamination. B. Dialysate overconductivity. C. Patient noncompliance. D. Inadequate ultrafiltration. Answer, A. A positive culture suggests water or dialysate contamination, requiring immediate disinfection and investigation. During pre-dialysis assessment, which finding would require delaying treatment and notifying the nurse? A. Hemoglobin 10G/DL. B. Potassium 6.5 milliequivalent/L. C. AV fistula redness and warmth. D. Blood pressure 140/85 mmHg. Answer, C. Signs of fistula infection, redness, warmth, must be reported before cannulation to prevent sepsis. Which condition is most likely if the dialyzer clots frequently during treatment? A. Low ultrafiltration rate. B. Inadequate anticoagulation. C. High potassium. D. Increased dialysate flow. Answer, B. Insufficient heparinization leads to clotting inside the dialyzer and extracorporeal circuit. The dialysate flow rate is set at 500 milliliters per minute. What is the primary benefit of this setting? A. Improves clearance of urea. B. Reduces blood pressure. C. Prevents air embolism. D. Increases venous return. Answer, A. Higher dialysate flow enhances diffusion of solutes, improving dialysis clearance efficiency. Which test is used to measure adequacy of dialysis by comparing urea levels before and after treatment? A. Hemoglobin A1C. B. URR, urea reduction ratio. C. Serum creatinine. D. Albumin/creatinine ratio. Answer, B. URR compares pre- and post-dialysis urea to evaluate treatment adequacy. A patient experiences severe itching after multiple dialysis sessions. Which factor is most likely responsible? A. Low phosphate levels. B. Elevated urea and phosphorus. C. Low hemoglobin. D. Increased calcium clearance. Answer, B. Uremia and hyperphosphatemia cause pruritus in dialysis patients. Which access complication occurs if needles are repeatedly placed at the same site? A. Thrombosis. B. Aneurysm formation. C. Brute loss. D. Stenosis of venous line. Answer, B. Repeated cannulation at one spot weakens vessel walls, leading to aneurysm formation. What is the primary function of the ultrafilter in water treatment for dialysis? A. Remove salts. B. Remove bacteria and endotoxins. C. Balance conductivity. D. Add bicarbonate buffer. Answer B. Ultrafiltration is the final barrier to endotoxins and microbes in dialysis water. Which action reduces the risk of disequilibrium syndrome during the first dialysis treatment? A. Increase blood flow rate. B. Use high-efficiency dialyzer. C. Start with shorter dialysis sessions. D. Increase ultrafiltration goal. Answer C. Short, gentle treatments prevent rapid solute shifts that cause cerebral edema in new dialysis patients. A patient's access site shows no bruit or thrill before treatment. What should the technician do? A. Cannulate carefully and begin treatment. B. Notify nurse and do not use access. C. Apply warm compress and retry later. D. Increase blood flow rate once started. Answer B. Absence of bruit/thrill means access failure or thrombosis. Do not cannulate until evaluated. Which dialysate composition helps prevent hypocalcemia during dialysis? A. High potassium. B. Calcium supplementation. C. High sodium. D. Increased bicarbonate. Answer B. Adding calcium in dialysate prevents hypocalcemia due to calcium loss during dialysis. What is the most common cause of death in long-term dialysis patients? A. Infection. B. Cardiac disease. C. Access failure. D. Stroke. Answer B. Cardiovascular disease is the leading cause of mortality in chronic hemodialysis patients due to fluid overload and electrolyte imbalance.